Good evening, everyone. Is my voice audible to everyone? Please let me know in the comment. Thank you so much. Good evening and regards. My name is Dr. Anand. Is my voice coming to everyone? Yes or yes, 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 yes. Yes. तो करते हैं आज की दुकान खोलते हैं. Let's start the session. Yes, good evening everyone. So yes, FMG exam is just around the corner. I hope we are excited, nervous, and all those things. Love you, lots of love, lots of love. Chalo, let's start off this class without wasting any further second. Oh, okay, fine. We'll just chat for 1 minute, and that is the break. That's it. Nothing else. Easy, easy है. बहुत easy है. कुछ नहीं है. In this, I'm going to take a short and crisp session because you're already saturated with the, heavy learning. So happy we'll take a class for 1 hour, and I'll be asking you a lot of so this exam now is just around the corner. Everything will be fine, everything will be super great. First of all, you guys have done it, we can rock it. Okay, yes, 2 minute का break लेते हैं, आराम से बातें करते हैं, not a problem. So I'll do one thing. I'll give you a small break of 5 minutes. We'll start the class at 7:03. With 7:03, you have 3 more minutes right now. We'll start the class at 7:03. सुसु करके आए, मुंह धोएं और जल्दी से छलांग मार के बिस्तर पे आ जाएं. I'll start the class at 7:03 and we'll finish some important questions and that's it. See you guys in 2 minutes. We'll start the class at Good evening, everyone. A beautiful day today. My name is Dr. Anand. Today is a beautiful day to share some immense amount of knowledge with all the excitement in the world. Let's start this class. I'm going to ask you a lot of questions, okay? In this marathon for the FMG, beautiful. This exam is just around the corner. We are starting the session. I'm going to ask you a lot of questions. Now, listen to me very carefully. So, in this session, very importantly, I want your full power pack performance. Yes, yes, I love you too. And at the same time, I'm gonna ask you questions. Try to answer as much as possible. Imagine this is your FMG exam today and you have pediatric question. The first question in front of you is this. Calculate the mid-parental height of a male patient with father height dash and mother height dash. In this, very importantly, I would like to ask you, what is the formula? Do you know the formula to calculate the mid-parental height? What do you think, guys? What is the name of the formula? Yes, exactly. So we have the father height plus we have the mother height. So father height plus mother height divided by 2 plus 6.5 as it is a male patient. Yes, exactly. Very good. That's the right answer. That is why. So automatically 183 plus 175 divided by 2 plus 6.5 as a male patient minus 6.5 we will do if this was a female patient. And the best answer for this question is option number A. I'm going to ask you a lot of questions and indirectly we'll just cover the theory, okay? Because right now at this moment the exam is just around the corner. So MCQ touch up is extremely important. Number one, what do you think, guys? Which anthropometric parameter indicates chronic malnutrition in a child according to WHO? What do you think? ABCD, quick answer back to back. This is a rapid revision now. ABCD, there's no time to revise and all that. So just pick up the question and tell the answer. That's it. So we all know that we have the beautiful mnemonic. The mnemonic is what? So W for weight, H for height, and A for age. Decrease weight for height, that is known as acute malnutrition, which is also known as wasting, and decrease height for age, that is known as chronic malnutrition, or nothing but known as stunting. Very healthy, very regular FMG PYQ. So that is why the best answer for this question is height for age. Is my audio video screen visible? Yes or yes, please let me know. Again, I will reshare little bit. Yes, 1 2 3 start. I hope the screen is visible right now. A boy came with abnormal facial features, hearing loss, and a congenital heart disease, as shown in the image. What do you think, guys? So, this baby, very importantly, mouth wide open, protruding tongue. What are we talking about? Yes, the best answer for this question is nothing but Down syndrome. And yeah, is my audio, video, voice coming? Yes or yes, please let me know. And also, which is the most common congenital heart disease in Down syndrome? The most common congenital heart disease in Down syndrome is endocardial cushion defect. Endocardial cushion defect, which is also known as AV canal defect, right? Very good. अच्छा, Noonan syndrome क्यों नहीं है? Positive, life is beautiful, cover the whole syllabus back to back. Why it is not Noonan syndrome? What do you think, guys? So Noonan will be a male patient with a webbed neck. Exactly, male patient with a webbed neck, that is known as Noonan syndrome. That's right. Very good. Okay, that's right. Why? Okay. So, and if it is a female patient with a webbed neck, then what will you write? So, female patient with a webbed neck, that is known as Turner syndrome. So, male patient with a webbed neck, Noonan syndrome. Female patient with a webbed neck, that is a Turner syndrome. Very good. That's right. Perfect. Let's have the next question. Which is the most common electrolyte imbalance seen in pyloric stenosis? What do you think, guys? FMG marathon. The exam is in few days. We will rock it. Everything is beautiful. Just see, the first thought is the final answer. Okay. Remember in the exam, the first thought is the final answer. Remember that. Yes, exactly. So very importantly, so yes, the most common electrolyte abnormality in pyloric stenosis is nothing but hypokalemia. And if I ask you one more question, what is the name of the surgery, guys? What do you think? Yes, my dear PBs, what's the name of the surgery for pyloric stenosis? The name of the surgery for pyloric stenosis is nothing but Ramstead pyloromyotomy. Yes, very beautifully said. Very true. That is Ramstead pyloromyotomy. Yes, exactly. The name of the surgery for pyloric stenosis is Ramstead pyloromyotomy. Very good. Beautiful answer. Everyone is crazy. But what mid upper arm circumference a measurement is used to diagnose SAM in children? Do you have any MUAC to diagnose SAM? Yes, exactly. Beautiful. The tape, definitely, we all know that. That is known as a Shaker tape. And in the Shaker tape, we are calculating the mid upper arm circumference. And if the mid upper arm circumference is less than 11.5, that means the baby is coming under which color Shaker tape? The baby is coming under red color Shaker tape. That is known as MAM. And very importantly, if the mid upper arm circumference is less than 12.5 centimeter, the baby is coming under which color Shaker tape? Yellow color Shaker tape, and that is known as MAM. That is known as MAM, and MAM stands for moderate acute malnutrition, and SAM stands for severe acute malnutrition. Beautiful answer by Ritik, Aryan, and Guddu. And very importantly, when mid upper arm circumference is more than 12.5 centimeter, means the baby is coming under green color Shaker tape, and green color Shaker tape means means normal, normal, normal. There's a very important PYQ, extremely important for exam purpose. You should be very good in PYQs, okay? इसी से उठ के आने वाला पेपर. A term newborn presents with tachypnea and chest section reveals fluid in the interlobar fissure. What do you think, guys? Fluid in the interlobar fissure. So very importantly, the classical sign for transient tachypnea of newborn, which is seen in a term baby, which is LACS born baby. Very importantly, right? If you remember, we spoke about it. Normal delivery में क्या होता है? The liquor in the lungs gets squeezed out, whereas in the case of cesarean section, the liquor in the lungs does not get squeezed out, and there is delay in the clearance of liquor. There is delay in the clearance of liquor from the lungs. Yes or no? Do you remember this? Yes or yes, yes. The delay in the clearance of liquor from the lungs happens in the case of transient tachypnea of newborn. Okay. And most importantly, let me ask you one more question. Which is the most commonest cause of distress? Which is the most commonest cause of distress in a preterm baby? Any idea? The most commonest cause of distress in a preterm baby, yes, deficiency of surfactant. I agree with you. And that condition is known as hyaline membrane disease, also known as respiratory distress syndrome. And what is the X-ray finding for hyaline membrane disease? Very, very important. Please remember that is white out lung. That is white out lung you see in a case of hyaline membrane disease. Remember that. Okay, very good. 9-month-old infant is able to roll over. In simple question, if I ask you, when can a baby roll over? Any idea? A baby ulte se सीधा, सीधे se ulta. A baby can roll over by 6 months. Okay, he can say baba, mama, dada. So baba or bye bye comes by how many months? It comes by 9 months. He has a stranger anxiety. Sir, मेरी गोदी में तो ठीक रहता है, आपकी शक्ल खराब है, आपकी गोदी में आके रोने लग जाता है. He's anxious on meeting strangers, which basically comes roughly by 6 months. Okay, yeah, 6 to 8 months, you can say that. And but he's unable to sit without support. So sitting with support comes by 6 months, and sitting without support comes by 8 months. It comes by 8 months. So well, the question is, which of the following is the most appropriate next step of management? So he can do a 9-month-old milestone. What do you think? A, B, C, D. What is the best answer? The best answer for this question, it's okay, yaar. One milestone, he is little lagging. No, it's okay, no problem. He will be fine. So the best answer for this question is nothing but reassurance. Exactly. Very good. You're right. Acha, let me ask you one more question. When can a baby draw a straight line? Any idea? When can a baby draw a straight line? So very importantly, a straight line has two ends. So 2-year-old can draw a straight line. When can a baby make a plus? So basically, a plus has four ends. So a 4-year-old can make a plus. Between 2 and 4, we have a 3. When can a baby make a circle? A baby can make a circle by 3 years. And imagine I'm making the circle with the left hand. Imagine I'm making the circle with the left hand. So handedness. Handedness basically comes by 3 years. Remember that. Okay. So very important for the exam purpose. Acha, I am Rahul. I am a boy. I am Rahul. I am a boy. Very importantly, what do you think? So yes, I am Rahul. I am a boy. So very importantly, the baby knows his full name, age, and sex by a baby knows his full name, age, and sex by 3 years, and he can go to toilet alone. He can go to toilet alone by 4 years. Okay. A baby knows his full name, age, and sex by 3 years, and he can go to toilet alone by 4 years. Remember that. Okay. So straightforward question. Very good. A 3-year-old child came with emergency department with sudden onset breathing difficulty and drooling of saliva. So difficulty in breathing, drooling of saliva, dysphagia, dysphonia. Where do you see all this condition? Very importantly. So in a pediatric population, okay, very good. Many are saying you see in a case of acute epiglottitis. I agree with you. But the problem is without any history of fever and cough. Now this is the main highlighter over here. The baby is having the symptoms of acute epiglottitis, but there is no fever and there is no cough. So that in the acute epiglottitis, the child must have a toxic look. That the child must have a very high grade fever, toxic look, and all that. So that is why this is not acute epiglottitis. This is a foreign body. This is a foreign body. Exactly. Puja ho gaya. Yes, I agree with you. So this is a foreign body. And let me ask you here, with every MCQ, I'll ask you two more MCQs. Okay. Foreign body less than 1 year, what do you do? And more than 1 year, what do you do? So less than 1 year old baby, what do? We do five back blows. बच्चे को उल्टा करके five back blows. And more than 1 year, what do? More than 1 year, you do Heimlich's maneuver. More than 1 year, you'll do Heimlich's maneuver. बच्चे के पीछे जाके five abdominal thrust. You will go behind the baby and you will do five abdominal first. Okay, so this is very important. Less than 1 year old baby ulta karke usko five back blows, and more than 1 year old baby will do Heimlich's maneuver. That is the management for the foreign body. A 4 year old child with weight for height less than minus 1 SD and height for age less than minus 2 SD. What do you think? What is the best possible management? So we all know that very importantly. So yeah, height for age is more compromised. No, in this height for age is more compromised. So exactly this is nothing but stunting, which is also known as chronic malnutrition. Let me ask you two more questions now with every MCQ. Skinny baby को क्या बोलते हैं? What do you think, guys? Skinny baby is known as skinny baby, that is known as marasmus, and the fatty baby, just like you. Okay, the fatty baby, very importantly, is known as kwashiorkor. The skinny baby is known as marasmus, and kwashiorkor is the fatty baby. And kwashiorkor is deficiency of proteins, whereas marasmus is deficiencies of proteins and calories. Marasmus is deficiency of proteins and calories. Very healthy, very frequent PYQ for FMG. Remember that. A newborn baby with feeble lower limb pulses and bounding upper limb pulses. कोई कुत्ता भी आंसर कर देगा. Oscar, where do you see feeble lower limb pulses and bounding upper limb pulses? Oscar's like, please, can you please ask tough questions? This silly question. He refuses to answer. Why? Because my doggy also knows that this is a aorta. In a case of coarctation of aorta or kind of a aortic stenosis, the blood basically it is coming. But when it comes to the descending aorta, very less blood is going down because of the aortic stenosis, which is nothing but known as coarctation of aorta. And that is why you will have a feeble lower limb pulses and you will have a bounding upper limb pulses. Feeble lower limb pulses and bounding upper limb pulses. That is why the blood pressure in the upper limb will be more than the lower limb. One extra question, exactly. So what is the X-ray finding? The X-ray finding of coarctation of aorta is figure of 8 appearance. The X-ray finding of coarctation of a figure of 3 or figure of 8, exactly figure of 3 appearance you see in a case of what you called coarctation of aorta. So these are the important thing you should know. So 15 questions are done. Has everyone understood this much? Yes or yes. Okay, screen जो हल्का सा lag हो रहा है कोई बात नहीं मैं reshare करता हूँ. I will stop the screen and I will reshare the screen. Maybe after resharing the screen, what you called, what you call, you must feel better. So everything will be fine. You know, your only limit is your mind. Your only limit is your mind. We can do this. What do you think, guys? Do you have the guts to clear this exam? Yes or yes? Please let me know. Do you really think we can do this? What do you think? So yes, we can do. We were born this way. It's very easy. हो जाएगा कुछ नहीं है कोई कुत्ता भी कर देगा कुछ नहीं है बहुत इजी है बहुत इजी है. So just try to, focus as much as possible and everything will be fine. Okay, everything will be fine. So let's just come to the next question. Okay, बहुत easy है हो जाएगा. Don't dishearten नहीं होना. बहुत अच्छा हो जाएगा बहुत बढ़िया होगा. Okay, next question. Okay. Identify the child whose growth is compromised. Now, which child growth has been compromised? A, B, C, D. What do you think? So, if I zoom this picture for you, this one, according to you guys, what do you think? Which child growth is compromised? So, this is the 50th percentile. This is normal. Anything less than that, that is means compromise. So, A and B are touching the 50th percentile, whereas the C baby, who doesn't eat properly, who eat momos and chocolates, he is having this problem. So that is why the best answer for this question, very importantly, is line C. A child present with disproportionately increased upper segment, lower segment ratio. So what is your diagnosis? A, B, C, D. Quick answer, quick answer. So increase. Someone is saying A. Where Dr. Dipanshu is saying A. Okay, very nice. Where okay, many are saying A. So very importantly, remember. So increase upper segment, lower segment ratio. The mnemonic was RHA. The mnemonic was RHA. R for rickets, H for hypothyroidism, and A for achondroplasia. A for achondroplasia. So rickets, hypothyroidism, and achondroplasia are the important conditions where you have increase upper segment, lower segment ratio. किस कुत्ते ने A बोला? Who is the angel who's told A? So anyone, can you please raise your hands? Who told A answer? Let me go back. Okay, Dr. Dipanshu, very nice, very good. अपने आप पे गंदी गाली दे और जिंदगी में आगे बढ़े. That's okay, चलता है. So decrease upper segment, lower segment ratio. Where do you see decrease upper segment, lower segment ratio? So all the spinal pathology, because in spinal pathology, upper segment is nothing but the spine. So when the spine is compressed, like kyphoscoliosis, TB spine, Allegilli syndrome, Aicardi syndrome, and spondyloepiphyseal dysplasias, they are the examples of decreased upper segment, lower segment ratio. Okay, so straightforward, extremely important for exam. Remember that. A 3-year-old child brought to the emergency department with a generalized seizure following a high-grade fever. Oh, doctor, my baby got a very high fever followed by a seizure. So what are we talking about? We're talking about febrile seizure. Yes or no? And very importantly, the question is first line drug of choice of febrile seizure. So we give rectal diazepam or intranasal midazolam, rectal diazepam or intranasal midazolam. So that's a drug of choice of febrile seizure. And febrile seizure is of two types. Let me ask you an extra question, theoretical revision. Febrile seizure कितने प्रकार का होता है? We have a simple febrile seizure and we have a complex febrile seizure, important for AIMS paper also. So what happens in simple febrile seizure? If my baby is having seizure, which happens for less than 15 minutes, happens once in a day, and this is usually a generalized tonic-clonic seizure. This is known as simple febrile seizure. Whereas the complex febrile seizure happens for more than 15 minutes, happen multiple times in a day, and this is usually a focal. एक हाथ घूमता है, focal seizure. Beautiful. This is the important you should know. And the drug of choice we have done. Now, very importantly, sodium valproate. Can you have extra questions now? Okay, yes, 100 questions are there. So, sodium valproate is a drug of choice in which condition? Any idea? Very good. कौन बोला ये? Kalyan has told. In a case of absence seizure, I know it is ethosuximide followed by sodium valproate, but nowadays we all talk about sodium valproate. And also in a case of juvenile myoclonic epilepsy, also, which gene responsible is there in juvenile myoclonic epilepsy? The answer is GABRA1. GABRA1 gene mutation you have in juvenile myoclonic epilepsy. Exam में question कैसे आएगा? What question will come in exam? The baby will have a twitching of fingers and dropping of objects. By looking at the FMG question paper, you're gonna have a twitching of the fingers and dropping of the objects. So imagine twitching of the fingers and dropping of the objects in a patient. So that is the juvenile myoclonic epilepsy, and the drug of choice is sodium valproate, and the gene mutation is GABRA1. Okay, a pediatric surgeon is planning from optimal time for cleft palate surgery. Now the question is, for the repair of cleft lip, how much time it will take? Straightforward question. You're gonna have a 3 to 6 months. 3 to 6 months you're gonna have for cleft lip, and 6 to 12 months for cleft palate. Like I spoke to Dr. Amrit Nasta, he just wrote simple at 3 to 6 and 6 to 12. 3 to 6 months for cleft lip and 6 to 12 months for the cleft palate. That's it. Straightforward, simple question. 24-year-old neonate came with severe distress, admitted to the ICU. X-ray shows this. Very simple, very easy. What do you think, guys? So very importantly, I can appreciate the intestinal contents have come up. This is a case of congenital diaphragmatic hernia, which is the most commonest extra question, which is the most commonest type of congenital diaphragmatic hernia. So very importantly, it is the posterior lateral variety. It is the posterior lateral type, which is also known as Bocker-Dulac hernia, And most importantly, auscultation में क्या मिलेगा? If you auscultate this patient, what will you get? When all the intestinal contents have gone to the chest, the patient will have a bowel sound in the chest. And this is the absolute contraindication of bag and mask ventilation. which is a very healthy exam question that you should know. Okay, which of the following condition is associated with unconjugated hyperbilirubinemia? So we all know that unconjugated hyperbilirubinemia, the mnemonic was CNG gas. The mnemonic was CNG gas. C for Crigler-Najjar syndrome and G for Gilbert syndrome. G for Gilbert syndrome. So Crigler-Najjar syndrome and Gilbert syndrome will have a unconjugated hyperbil. Whereas what extra questions now? What are the causes of conjugated hyperbilirubinemia? So very importantly, we have something known as Dr. Bhatia. Dr. Bhatia. D for Dubin-Johnson syndrome, R for Rotard syndrome, and B for biliary atresia. Okay, 20 questions are done. Has everyone understood this much? Yes, 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 yes. Please let me know. Revision plays a very important role because the exam is just in few days. All you need to know, yes, Dipanshu, is just revise, look at the MCQ. You must know the answer. Like what, how to get the best MCQ? FMG last moment thought. Number one, whenever you open the paper, no, just have five deep breaths. Okay, like one, two, three, four, five. Inhale, then one, two, three, hold, and one, two, three, four, five, exhale. Do this five times just before the paper and early morning, also at the same time. Number one. Number two, very importantly, the first thought is the final answer. The first jo lag raha hai, when you open the question, guys, you feel this is the right one. The first thought is the final answer. Please remember that. And most importantly, avoid cramming and start understanding the concept. Try to feel the question, what your gut feeling says, and that is the best answer that you should know. Don't overthink in the question. Remember that. Okay, a 2-year-old child came with complaints of fast breathing on examination. The RR is 48. So, what do you think, guys? Is it pneumonia, no pneumonia, severe pneumonia? What is this? So, my dear family, yes, we have cerebellum party is coming very soon. Do whatever. See, this is your best attempt. This attempt is the best attempt of your life. Remember that way, feel that way, and do that way. I remember half is over, syllabus is not done. It's okay, Babu. It happens. Chill, relax. But keep telling yourself whatever coming in front of my eyes is the first and last time, and I will always, always remember. So fast breathing with or without chest and drawing is known as pneumonia. Fast breathing with or without chest and drawing is known as pneumonia. So what is fast breathing? So we have 0 to 2 months, 3 months to 1 year, and 1 year to 5 year having respiratory rate more than 60, 50, and 40. So this is the respiratory rate cutoff for the fast breathing. So the 2-year-old child. So 2-year-old child, okay, 2-year-old child, the RR more than 40 is fast breathing. Here the RR is 48. So yes, this baby is having fast breathing. So fast breathing with or without chest and drawing is known as pneumonia. If there are danger signs also, if there are danger signs also, that is known as severe pneumonia. Like as in, doctor, my baby is not feeding well. Doctor, my baby is vomiting, lethargic, seizure, severe pneumonia. And what is the management for the pneumonia? We'll give oral amoxicillin for 5 days. I'll repeat again. Yes, very importantly, for the pneumonia, very importantly, we have the home treatment and oral amoxicillin for 5 days. I'll repeat again, for pneumonia, we have very importantly home treatment and oral amoxicillin for 5 days. Whereas, very importantly, for severe pneumonia, what is the management for severe pneumonia? The management for severe pneumonia, very importantly, is admit the child and we give injection. We'll give injection ampicillin and gentamicin. We'll give injection ampicillin and gentamicin. So this is very, very important for the exam purpose. Little bit lag is happening. It's okay because that's an internet thing. What can I do? I'm trying my best to repeat as much as possible. Whatever you're able to understanding, try to get it because this is the best option we have. Okay, so that's what. Okay, so yes, very importantly, so this is a very important point. Okay, very important point. Yes, my dear. Okay, so I'll repeat again. Fast breathing with or without chest and drawing is known as pneumonia. For that, we'll give home treatment oral amoxicillin for 5 days. Whereas, very importantly, for severe pneumonia, remember, is nothing but, or very importantly, admit the child and injection ampicillin and gentamicin. Okay, yeah, this is a very nice question, guys. A child diagnosed with Dravet syndrome who is already receiving multi-drug anti-seizure therapy? Such a long question. The question is, the child is suffering from Dravet syndrome and he is on a drug known as fenfluramine. Now, the question is very important. Yes, my dear Vishali Singh, given the known pharmacological adverse effects profile for fenfluramine, which monitoring I should do? In simple words, in very simple line, my dear Vishali, the child is having Dravet syndrome. He is on fenfluramine. So the question is, which adverse effect I should be aware of regarding fenfluramine? Now, number one, just in simple, remember, fenfluramine can basically attack on the pulmonary artery. Just remember, as a one-liner, just like a last moment revision one-liner, fenfluramine can attack on the pulmonary artery and it can cause pulmonary hypertension. That is by doing a serial echo looking for the pulmonary artery and pulmonary hypertension. That is the best answer for this question. So as a one liner, I should know if someone is having on Dravet syndrome, he is on fenfluramine, or in pharmacology question, someone is on fenfluramine, which is an anti-seizure medication. That patient, you should do a echo to rule out pulmonary artery issues or pulmonary artery hypertension. Now, very importantly, Dravet syndrome. Now, what is the meaning of, if I am a FMG student? Question comes, what is Dravet syndrome? Yes, my dear Bittu, a drug of choice for Dravet nahi hai. Dravet syndrome is on multiple drugs used for Dravet syndrome. There is no single drug of choice. Okay. Now, what is Dravet syndrome? I am a patient of very high fever followed by a seizure. Listen very carefully. Actually, I am a patient of febrile seizure. The patient will be a febrile seizure. What is febrile seizure? Very high fever followed by a seizure, and then I'm going on multiple anti-epileptics. Like I am on multiple anti-epileptics. Means just by rectal diazepam and intranasal midazolam, I'm not getting the relief actually. So again, I'm getting seizure. So someone having febrile seizure on multiple anti-epileptics and he developed developmental delay. Kind of a mental retardation. इतना दोहरे का दवाई चल रहा है कि बच्चा बिल्कुल पागल हो गया. So much of seizure medication is happening. The child is having mental retardation, which is now known as intellectual disability. So the story starts with a febrile seizure patient having multiple episodes of seizure on and multiple anti-seizure medication, and he developed developmental regression. This is the story, remember, regarding the Dravet syndrome. Okay, Dravet syndrome. Okay, so this is one thing. Now, very importantly, what is fenfluramine? I told you it basically having a cardiac problem. That is nothing but pulmonary artery hypertension. Now, this is a very interesting question. The other question was monthly complete blood count for CBC. Okay, so CBC, complete blood count, we do for what? So complete blood count, very importantly, if the patient is on carbamazepine, no, there you do complete blood count. The class will be till 8:30 p.m. 1 hour more, just 1 hour more, and then we are done for the pediatrics. So this 60 minutes are most crucial for your life. Okay. So very importantly, carbamazepine if the patient is on CBC, I will do. One more question was there, ophthalmic examination for monitoring visual field defect. कौन से drug पे हम visual field defect को check करते हैं? This is also very important. Remember, V for vigabatrin, V for visual field. Okay, V for the patient is on vigabatrin, so visual field defect to be seen. And last but not the least, liver function test and ammonia levels. Which drug is connected to liver function test and ammonia levels? So very importantly, valproate. If the patient is on sodium valproate, very importantly, please remember that yes, the patient will have this problem. So this is very important for the exam purpose. Okay, like this is a pure pharma. So I'll repeat again as a one-liner. I will always remember that what you called fenfluramine will cause pulmonary artery hypertension. Vigabatrin will cause visual field defects. Sodium valproate will cause for that you have to get a LFT and ammonia. And C for CBC, C for carbamazepine. Okay, C for CBC, C for carbamazepine, V for visual field defects, V for vigabatrin. This is like very, 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 very important for the exam purpose that you should know. Okay. ओके, निमोनिया क्वेश्चन में ठीक है. अच्छा, someone is saying कि निमोनिया क्वेश्चन वाली स्लाइड दिखा दो. अच्छा, ठीक है. So I'm going back again. This was the pneumonia and I'm resharing my screen also. 1 second. This is the back, this is the one, and this is resharing the screen. So again, a quick pause for 10 seconds. Come deep breathing, please. Take a deep breath. 1, 2, 3, 4, 5. Now hold it. 1, 2, and 3. Now exhale. Yes, exactly. तो वेरी सीवियर निमोनिया जैसा कुछ नहीं होता. वेरी सीवियर. Okay, Ritik Kumar has a point. If someone is having a lagging issue, rejoin and you will feel better. Okay, someone is saying rejoin kar lo to lagging ka issue nahi rahega. So yes, very importantly, okay, yes, Dipanshu, thank you so much. Fast breathing with or without chest and drawing is known as pneumonia. If there are danger signs, that is known as severe pneumonia. There is nothing known as very severe pneumonia. Very severe pneumonia जैसा कुछ नहीं होता. It is only pneumonia and severe pneumonia. ठीक है? ओके, सो अगेन अ क्विक मोटिव शायरी. वो कहते हैं कि मैंने उसको इतना देखा जितना देखा जा सकता था. मैंने उसको इतना देखा जितना देखा जा सकता था, फिर भी दो आंखों से कितना देखा जा सकता था. The next question of choice: a 6-month-old infant presents with recurrent infections, failure to thrive, and laboratory investigation shows a definition, the deficiency of ADA. What do you think, guys? What are we talking about? What do you think? ABCD, quick answer, quick answer. Okay, someone is saying SCID. Okay, very good. Why it is not Viscott-Eldridge syndrome? Maybe this is a Viscott-Eldridge syndrome. So always remember, for severe combined immunodeficiency, this is your last revision. Hello, listen very carefully. Now, very importantly, yes, if the patient is in the MCQ, if the patient is having recurrent infection in the MCQ, if the patient is having recurrent infection and failure to thrive, if FTT, failure to thrive. Failure to thrive means the baby is not gaining weight and height. So this is the classical case of SCID, and the deficiency of the enzyme, very importantly, is nothing but adenosine deaminase. Why it is not Viscott-Eldridge syndrome? In NEET PG paper, the question had come on Viscott-Eldridge syndrome. Yes, अभी sir ने पढ़ाया था. Very good. In Viscott-Eldridge syndrome, very importantly, you will have thrombocytopenia. You will have thrombocytopenia and, very importantly, eczema. Thrombocytopenia and some infection on the body, eczema. Plus, the patient will have recurrent infection. See, recurrent infection is there in SCID also, but in Viscott-Eldridge syndrome, you will have severe infection with some skin rashes and with thrombocytopenia. That was a NEET PG question had come. Very important for the exam purpose that you should know. Only recurrent infection is SCID, infection with thrombocytopenia and eczema. The answer is Viscott-Eldridge syndrome. A child present with neurodegeneration and a cherry red spot on fundus examination. Very hot topic. Cherry red spot on fundus examination. There is a deficiency of the enzyme hexosaminidase 1. So what do you think, guys? What are we talking about? Yes, exactly. You're right. We're talking about GM2. Yes, you're tired, right? We're talking about a GM2, which is which disease are we talking about? Any idea? Yes, very good, Mohammed Asif. कौन सी बीमारी का बात हो रहा है यहाँ पे? We're talking about Tay-Sachs disease. We're going to talking about Tay-Sachs disease. And what is the deficiency of the enzyme in Tay-Sachs disease? Very importantly, this only enzyme, that is hexosaminidase A. Okay, hexosaminidase A. So, and here very importantly, yes, you see a cherry red spot. This was again a PYQ. So cherry red spot, it is seen in the case of GM2, that is Tay-Sachs disease. The question was, what's the deficiency of enzyme? The answer is hexosaminidase A, and you see a cherry red spot. Now, very importantly, GM1. Who will tell me about GM1? Now, GM1, we all know that this is a lysosomal storage disorder. These all are the lysosomal storage disorder. But the question is, what is a deficiency? Very good, that's right. Deficiency of beta-galactosidase. The beta-galactosidase is the deficiency of the enzyme. Very good, that's right. You have in a case of GM1. Okay. नाउ वेरी वेरी इंपॉर्टेंटली निमैन-पिग डिजीज. ये निमैन-पिग डिजीज क्यों नहीं है? बात तो एक ही है. नाउ निमैन-पिग डिजीज विद डेफिशिएंसी ऑफ एनी आइडिया, दैट इज sphingomyelinase. Okay, deficiency of sphingomyelinase. Very very importantly, you have in a case of Niemann-Pick disease. Remember that. Okay, and Niemann-Pick disease also you will have a cherry red spot. So this is very important. Cherry red spot you have in Niemann-Pick disease also, and you have in what you call this GM2 also. And yes, someone told very beautifully, you will see foam cells. Okay, this is also someone has commented. That's very true. You will see foam cells. So Niemann-Pick disease, very, very important. And last but not the least, what happens in Gaucher disease? Deficiency of which enzyme? Very importantly, that is glucocerebrosidase. Glucocerebrosidase. You have to cram this only. Cram, cram, cram. That's it. Yes, everyone is Divanshu, Kalyan, Atif, Wolf, Abdul. Very good. That's right. So deficiency of the enzyme glucocerebrosidase. And one more thing they ask in exam, bone marrow show crumpled paper appearance. This is very importantly, a picture will have have in the questions also. Crumpled paper appearance, very importantly, you will see in a case of Gaucher disease. So this is a very, very important slide. We have some multiple five, six questions over here. Cherry red spot, please remember, as a one-liner, it is seen in the Tay-Sachs disease also. It is seen in Niemann-Pick disease also. But the only difference is the enzyme deficiency, which is very, very important that you should know. Very important for the exam purpose. Now, next important point, a newborn baby came with complaints of hepatitis and cataract, lethargy, and hypotonia. Yes, exactly. So, what is the problem are we talking about? Now, this is very important that what do you call cataract, okay. So very importantly, we all know, where do you see oil drop cataract? So oil drop cataract, you all know, we see in a case of galactosemia. Oil drop cataract you see in a case of galactosemia, and galactosemia has two enzyme problem: galactose 1 phosphate uridyl transferase, which is known as a GALT enzyme, and galactokinase also. But the problem is, in the MCQ, if you have a isolated cataract, this is very important. In the MCQ, if you have a isolated cataract, just in the question is only cataract, then to it is galactokinase deficiency. Otherwise, very, very importantly, the answer, the typical enzyme for, what you call, yes, exactly, for galactosemia is nothing but, very importantly, that is GALT enzyme. We all know that whatever the mother is feeding her child, the galactose get converted into glucose, and the enzyme responsible over here is GALT enzyme. If the patient has a, very importantly, GALT deficiency, so galactose will accumulate, and the patient will have a hypoglycemia. And yes, someone very beautifully mentioned, yes, exactly, is nothing but, very importantly, the absolute contraindication. Yes, Shakir Shah, yes, it is the absolute contraindication of breastfeeding is nothing but galactosemia or lactose intolerance. Galactosemia or lactose intolerance are the absolute contraindication of the breastfeeding. CFTR gene mutation. Yes, Oscar, where do you see CFTR gene mutation? So CFTR gene mutation, we all know, we see in a case of cystic fibrosis, where the mother, while kissing her child, found her child's skin salty tasting skin. Okay, salty tasting skin. And what is the hallmark of cystic fibrosis? Very importantly, yes, exactly. So FMG, अगर वो खाली आइसोलेटेड अगर वो आएगा ना कैटरेक्ट, तो galactokinase deficiency चूज करके आओगे, ठीक है. Okay, come back again. Yes, salty tasting skin, that's right. And also, very importantly, what is the hallmark of cystic fibrosis? The hallmark of cystic fibrosis is elevated sweat chloride levels. More than how much? More than 60 milliequivalents per liter. A mother, while kissing her child, found her child's skin salty tasting. So sweat chloride levels will be elevated, and most importantly, more than 60 milliequivalents per liter. And what is the second best investigation? Any idea? The second best investigation for this will be NTPD. What is NTPD? That is nasal transmembrane potential difference. Nasal transmembrane potential difference, as a one liner you should know, is the second best investigation for cystic fibrosis. And in the treatment, what do you think, guys? Do you know some drug or something very importantly? Yes, we have Eva and Alexa. Eva and Alexa. So very importantly, Eva for Ivacaftor and Alexa for Alexaftor. Eva and Alexa, Ivacaftor and Alexaftor, and they have a common friend known as, his name is Teza. That is Tezacaftor. So these are the most important drugs we have: Ivacaftor, Alexaftor, and Tezacaftor. For cystic fibrosis, a mother, while kissing her child, found her child's skin salty tasting. Simple, simple, simple. That's it. Okay. Again, now I'm giving you a 3 minutes of break. 7:45. We'll start the class at 7:45. Deep breathing, have water, go to washroom, and come exactly at 7:45. Thank you. आएगा एग्जाम में भी याद आएगा, कोई ऐसी बात नहीं है। बहुत अच्छा होगा, बहुत सुंदर होगा। सब बार बार अपने आप को यही बोलते रहो, आई विल रिमेम्बर, आई विल रिमेम्बर, आई विल ऑलवेज रिमेम्बर। सो यस, लेट्स डू द नेक्स्ट क्वेश्चन एंड प्लीज रिमेम्बर, डोंट से आई कांट डू इट, आई कैन डू इट, कैन। So I can do it. We were born this way, Dipanshu. Everything will make sense. Everything will make sense by the end of the journey. Just do it, bro. Just do it. हो जाएगा. Just कूद जाओ उसके ऊपर, एग्जामिनर के ऊपर। A 3 week old infant presents with non-bilious vomiting and an olive-shaped mass. So where do you see olive-shaped mass? We all know, we see in a case of congenital hypertrophic pyloric stenosis. If this was a baby with non-bilious vomiting but a normal abdomen, so normal abdomen, then I would have chosen GERD, gastroesophageal reflux disease. Okay, if this is a normal abdomen, I would have chosen GERD, gastro, baby will have vomiting and all that. Whereas olive shaped mass, of course, we know congenital hypertrophic pyloric stenosis. And very importantly, in the ultrasound, what is the ultrasound finding for congenital hypertrophic pyloric stenosis? So pyloric stenosis, pylorus. So remember 4 by 16. So 4 mm if we have the pylorus thickness, and very importantly 16 mm if we have the pylorus length. So 4 mm thickness and 16 mm length. That is the ultrasound. Very importantly finding in a case of congenital hypertrophic pyloric stenosis. 4 by 16 important for the surgery. And very importantly, one more thing, the mother would have taken which drug during pregnancy? If the mother has taken erythromycin during pregnancy, if the mother has taken erythromycin during pregnancy, the baby can land up into pyloric stenosis. Okay. So simple exam question you should know. A newborn baby born with this problem, need PG, PYQ, and it will come in FMG also. They all are copy pasting same question for NEET and FMG. So this is the bladder exostrophy. Okay, this is the bladder निकल के बाहर आना पड़ता है. This is the whole bladder. Okay, so it's a bladder exostrophy. Remember that. Okay, so in simple, straightforward, this defect. Photographic memory, photo. I hope this photo comes to your dream tonight. So this is very importantly, bladder is coming out. This is not gastrochisis. किसी ने बोला gastrochisis? Gastrochisis is different. When all the intestinal contents are out, that is gastrochisis. This is the urinary bladder which is coming out. Okay, so remember that is very importantly bladder exostrophy. A child presenting with intellectual disability, hepatosplenomegaly, and bone marrow shows a crumpled paper appearance. Straightforward question. Where do you see crumpled paper appearance? We all know in a case of Gaucher disease, and very importantly, deficiency of enzyme glucocerebrosidase. Okay, so that's what. So this looks like so easy. Crumpled paper appearance is nothing but Gaucher. But the thing is, like again, Gaucher में which enzyme deficient, that you have to remember. So double trick. Okay, so remember that is nothing but glucocerebrosidase is important for the exam purpose, that you should know. Okay, I will reshare the screen. 1 second, I will reshare. I have told the backend team also that little bit it is what you call it, lagging. Some people are saying it's coming normal, some are saying it's lagging. Okay. Okay, so next question. A newborn baby delivered by lower segment cesarean section with respiratory distress and X-ray has a fluid in the interlobar fissure. Acha. So X-ray will have fluid in the interlobar fissure. What do you think? What are we talking about? So best we all were talking about transient tachypnea of newborn. And I have one more question to ask you over here. What is the treatment for transient tachypnea of newborn? The treatment for transient tachypnea of newborn, very importantly, is nothing but it is a self-resolving problem. It is a self-resolving problem. Now look at the camera. So A for वो क्या है? Oscar क्या है? Oscar. B for. So what do you think? So when can a baby knows his full name, age, and sex? So baby knows his full name, age, and sex by 3 years, and he can go to toilet alone by 4 years. अच्छा बाय बाय करो बाय बाय इधर बाय यहाँ पे कैमरे पे. So when can a baby say bye bye? Bye. So bye 9 months. Star का है star. Okay. थप्पड़ खा लेगा भाग जाए इसके. ठीक है. So very importantly, the next question we have it over here is which is the most commonest cause of distress? Which is the most commonest cause of distress in a post-term baby? So the most commonest cause of distress in a post-term baby क्या 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 सर्विस होके आया लगता है शाम को थप्पड़ खाया. Now the most commonest cause of distress in a post-term baby, remember it is a meconium aspiration syndrome. And which is the most commonest cause of distress in a preterm baby? The answer is hyaline membrane disease, which is also known as respiratory distress syndrome. And the most commonest cause of distress in a term baby is nothing but transient tachypnea of newborn. Okay? Yes, exactly. Okay, so this is a very important setup of exam question you should know. Okay, important. Next one. Which of the following is not a cause of stridor in a child? Yes, exactly. Which of the following is not a cause of the stridor in a child? So yes, that is also very important for the exam purpose. The most commonest cause of stridor in a child is laryngomalacia, and the other causes are laryngeal web, laryngeal stenosis, or even vocal cord paralysis also. Even vocal cord paralysis also. This is also commonest, well, few causes of stridor. But very important for the exam purpose, that is nothing which is not a commonest cause of stridor. Remember very importantly, hemorrhagic polyp. It is not a cause of this stridor. Remember that. Okay. ऐसे क्वेश्चन आने चाहिए. ये नीट पीजी में आया था इस साल. अगर ऐसा आ गया तो बहुत अच्छी बात है. तो ये क्वेश्चन आए हुए थे. ठीक है. Now next important question is, yes, this is the FMG PYQ. Babies noted to have a persistence of the ATNR. This is a very classical question. So this is asymmetric tonic neck reflex, which is also known as bow and arrow reflex. The question is, normally, can you tell me when does ATNR disappears? ATNR disappears by 6 months. When does Moro reflex disappears? Moro reflex also disappears by 6 months. So what is ATNR or bow and arrow? Once I turn the baby head to one side, one limb extend and one limb flex. This is a bow and arrow. If I do like this, the baby does like this. So 6 months it disappears. 6 months it disappears because 6 months the baby starts to roll over. Okay. So the question is, if this reflex does not disappear, then what the baby cannot do? The baby cannot do rollover because rollover comes by 6 months and ATNR disappears by 6 months. Remember that. A 5-year-old came with complaint of swollen and bleeding gums, fatigue, and bone pain. Straightforward question. Swollen gums, all those things. So this is straightforward. It's vitamin C. Okay. So vitamin C deficiency, nothing but we have this scurvy, unimportant for the exam purpose. Scurvy, straightforward question. Okay. So next question. Inshore technique is used in which condition? Yes, very importantly, we all know that inshore technique. So exactly, scurvy में क्या होगा? देखो, जब बता दूंगा बाद में आएगा, दोबारा एक और क्वेश्चन आ रहा है तब बता दूंगा मैं. So yes, we all know that the most commonest cause of distress in a preterm baby is nothing but a hyaline membrane disease, which is also known as respiratory distress syndrome, where in X-ray, what do you see? White out lung. Okay, क्योंकि surfactant का deficiency है. There's a deficiency of surfactant, so lungs will not be formed, having a white out lung. So what is the treatment for this problem? The treatment is nothing but I will give surfactant. And how do you give surfactant? It is given by in-shore technique. What is in-shore? That is in for you intubate the patient, you give surfactant, and then you extubate the patient. So intubate, surfactant, and extubate, straightforward, is nothing but an in-shore technique used in the case of hyaline membrane disease, where you see a white out lung. All of the following are true about neonatal cholestasis, except now what is false means what is false about neonatal cholestasis. Biliary atresia is the most commonest cause. That's true. HIDA scan is done. That is also true. It can be differentiated from other forms by biopsy. That is true. Kasai procedure roughly by 60 days. Okay. Kasai procedure we do by 60 days. Okay. Not 90 days. So this is the false statement. So one liner, Kasai procedure is done by 60 days, not the 90 days. Which of the following is not a component of tetralogy of Fallot? Oscar, what is not seen in tetralogy of Fallot? So we can quickly revise. In tetralogy of Fallot, tetra, the patient will have a right ventricular hypertrophy. The patient will have a ventricular septal defect, which is a right to left shunt in this condition. And the patient has a pulmonary stenosis. And the patient has a overriding of, I mean, लड़की आ गई मैं लड़का है. ठीक है, overriding of aorta. The patient will have a overriding of aorta. So ASD and LVH are not a part of the what you call tetralogy of Fallot. That is straightforward question. And one more question: where do you see boat-shaped heart? Who will tell me? Boat-shaped heart. It is seen in tetralogy of Fallot. Where do you see box-shaped heart? Box-shaped heart you see in a case of Epstein anomaly. And the mother would have taken which drug during pregnancy? If the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. Where do you see figure of three appearance and figure of eight appearance? Figure of three appearance you see in a case of coarctation of aorta, and figure of eight appearance you see in a case of supracardiac TAPVC. Supracardiac TAPVC. Someone saying only TAPVC, अपने आप को एक गंदी सी गाली दीजिए, because only supracardiac TAPVC will have a figure of eight appearance, because infracardiac TAPVC presents as white out lung. Okay. Next question, a 4-year-old child with muscle wasting and skinny appearance. Muscle wasting, skinny, straightforward. Muscle wasting and skinny appearance that you see in a case of marasmus. Let me always very importantly say, what is the hypoglycemia cutoff in SAM? Can you please answer in the comment section? What is the hypoglycemia cutoff in SAM? Is it 45 or is it 54? So less than 54 is nothing but neonatal hypoglycemia. And SAM, it is seen in 6 months to 5 years. Okay. So there the hypoglycemia cutoff is less than 54, and less than 45 was neonatal hypoglycemia. A boy with developmental delay, hypotonia, hypogonadism, and genetic analysis has some chromosome 15 involvement. So, boy patient with the gonad problem, what are we talking about? So, this is an example of uniparental disomy. These are the example of uniparental disomy. What are the examples of uniparental disomy? We have Angelman syndrome and we have Prader-Willi syndrome. Angelman syndrome, Prader-Willi syndrome, even Russell-Silver syndrome also. Even Russell-Silver syndrome also has a what is called a uniparental disomy. So Prader-Willi syndrome, very importantly, remember the mnemonic Papa ki moti girlfriend. So Papa ki moti girlfriend is the mnemonic for Prader-Willi syndrome. So P for paternal gene is deleted and maternal gene is doubled. And M for very importantly micro penis. M for micro penis, O for obesity, and Papa ki moti, I for increased appetite and as well as intellectual disability. Okay. Yes, exactly. So these are the beautiful important points. Yes, अच्छा ठीक है. समझ जाएंगे सर धीरे बोलो मम्मी पीछे बैठी है. Okay, fine. So Papa ki moti girlfriend, P for paternal gene is deleted and maternal gene is doubled. M for micropenis, O for obesity, and I for increased appetite and intellectual disability. So these are the very important points for the Prader-Willi syndrome, and that's the question. It's a boy patient. Okay, remember. Yeah, so these are the important points you should know. And yes, it's chromosome 15 involvement was a FMG PYQ 2026 question. Remember that. Okay. Allegany syndrome. Okay. Any idea for Allegany? What do you think? Okay. So Allegany syndrome, remember very importantly, there was a micro puppet show. There was a micro puppet show which got delayed by 15 minutes. Okay. Imagine a story. There was a micro puppet show which got delayed by 15 minutes that made the mother hyperactive. Imagine, tell yourself, hello, you're reading this for the first and last time. If you pay attention now, your 6 months are saved, your life is saved. We'll be in Cerebellum party, taking selfies and videos and doing dance and, having sharab, which I have left recently. So very importantly, Angelman syndrome, there's a micro puppet show which got delayed by 15 minutes, which made the mother hyperactive. So micro for the patient will have a microcephaly. Puppet for the patient will have a happy puppet faces, happy puppet faces. This show got delayed, so the patient will have a developmental delay. Which chromosome involved? Chromosome number 15 is involved. And that made the mother hyperactive. So the patient is hyperactive just like you and made the mother M. So M for maternal gene is deleted where and paternal gene is doubled. Yes, exactly. Okay. हाँ जी हम lime soda पी लेंगे. That's right. Yes, I am a pure vegetarian and I don't consume alcohol. So you also become vegetarian. Angular cheilitis, stomatitis, and glossitis are seen in which problems? So in general, yes, this is the simple issue is vitamin B1. So vitamin B2 basically, yes. Vitamin B1 is thiamine and vitamin B2 is riboflavin. B1 is thiamine and B2 is riboflavin. Okay. And B1. So vitamin for vitamin B1 deficiency, what do you think, guys? Yes, my dear Dr. Wolf. which staple diet I should have for vitamin B1 deficiency. So if someone is consuming polished rice, if someone is consuming polished rice, very importantly, he is going to have a deficiency of vitamin B1, remember? And yes, vitamin B1 deficiency, the patient will have a berry. And yes, we have a dry berry, and we have a wet berry. Remember that dry berry and wet berry. Remember, okay? 5-year-old child with rapid breathing and distress, X-ray shown below. Exactly. So this is a straightforward X-ray. We all know that this is nothing but a laryngeal spasm, nothing but a steeple sign. So where do you see steeple sign? It is seen in a case of croup, which is the most commonest cause of croup. It is para-influenza virus. The most commonest cause of croup is para-influenza virus. So how the question will come? Exactly. Very good. That's very right, Dr. Wolf. So how the question will come? The patient will have a distress, but the patient will have aphonia. आवाज नहीं निकल रहा सर, my sound is not there. Aphonia the patient will have. And जिस तरह तुम घर पे चिल्लाते हो, barking cough, कुत्ते जैसा भौंकते हैं. So barking cough the patient will have aphonia, आवाज voice change. So that gonna have in croup. And what is the treatment for croup? Very important for the exam purpose. So when you have this laryngeal spasm, you're gonna have a steroid. So dexamethasone and adrenaline nebulization. Dexamethasone and adrenaline nebulization, very importantly, it is the treatment for the true. Very important hot topic. Dexamethasone and adrenaline nebulization. Remember that. Okay. Yes, that's very true. Okay. Child suddenly become coughing, developing distress after accidentally aspirating a peanut. Exactly. So after peanut, he can have this problem. But the question is, what will you do? So after taking peanut, what will you do? Very good. That's right. So it's a child. Okay. So more than 1 year, what do you do? More than 1 year, you'll do a very importantly Heimlich's maneuver. Some people, yes, someone किसी समझदार व्यक्ति ने किया है B. So B will do for an infant, okay. Less than 1 year is an infant, okay. If this question was an infant, I would have done, 5 back blows, but this looks like a child. So child is not an infant. That is nothing but A. So someone is saying tracheostomy. अपना करवा लो तुम tracheostomy. इसका तो ना कर रहे भैया. ठीक है. Next question, please. With all love, my dear Dipanshu. 2 days old neonate develop bilious vomiting and X-ray shows double bubble sign. So where do you see double bubble sign? Double bubble sign you see in a case of duodenal atresia. Where do you see single bubble sign? Single bubble sign you see in a case of pyloric stenosis. Okay, straightforward question, double bubble sign. Child with recurrent episodes of cough and cold diagnosed the acyanotic congenital heart, and that is a VSD is diagnosed. So the question is, what type of what you called murmur you see in a case of VSD? In a VSD, you will have a pansystolic murmur, whereas where do you see continuous machinery murmur? So continuous machinery murmur you see in a case of PDA. Continuous machinery murmur you see in a case of PDA. And where do you see pansystolic murmur? The answer is VSD. Where do you see egg on side appearance? Any idea? Egg on side appearance. So egg on side appearance you see in a case of TGA. Yes, that's right. Where do you see sitting duck sign? So sitting duck sign, very importantly, you see in a case of truncus arteriosus. In a case of truncus arteriosus, you will see a sitting duck sign. So again, has everyone understood this much? Yes or yes. Please let me know. Soon we will cover. I hope my voice, audio, video is coming to you. Yes or yes. Again, a deep breathing, relax. Take a deep breath with me. Inhale now. Hold your breath. 1, 2, and 3. And exhale. Exhale. So everything will be fine. I'll have water. Again, a quick break. ठीक है. डॉक्टर स्लीपी कह रहा है बस एक पीडिया ही आता है, बस और कुछ नहीं. यू विल रॉक, एवरीवन विल रॉक. एवरीथिंग विल बी फाइन. एवरीथिंग विल बी ग्रेट. दीपांशु कहता है एनर्जी आ जाती है सर आपकी क्लास में. लाइफ इज ब्यूटीफुल. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. अब नहीं तो कब कब करेंगे फिर. जो बीत रहा है वो वक्त नहीं, जीवन है. सो उसको ऐसे ऐसे फील करो. फील दिस, ओके. सो डीप ब्रीदिंग. keep on doing deep breathing, guys. It will be really helpful for you. Okay, and remember, everything will be fine. Just manifest. You will remember the question. First thought will be the final answer, and you will get a very, very, very happy result. Okay, remember that. Okay, so this is you. This is imagine. This is your face. Imagine. See happy songs. Feel happy. Okay, we will get the grade. We deserve this, and we will get this. The next question we have it over here is: a unit came with prolonged neonatal jaundice, umbilical hernia, and generalized hypotonia. Straightforward question. What do you think, guys? What are we talking about? So, neonatal jaundice, prolonged jaundice, poor tone, hypotonia. Remember, very, very importantly, the patient P. Number one, very importantly, P for prolonged jaundice. P for prolonged jaundice. Now, very importantly, P for poor tone. P for poor tone. That's why the patient got hypotonia. And very importantly, P for pot belly. P for pot belly. P for posterior fontanelle was open. Posterior fontanelle will be open. And very importantly, the patient will have a protruding tongue. So this is nothing but congenital hypothyroidism. Okay. This was the FMG PYQ, a 4-month-old baby having prolonged jaundice and a posterior fontanelle open. The straightforward question was congenital hypothyroidism. 5-year-old child eagerly drinking the bottle of water, eagerly drinking the bottle. Which category? Yes, again, a very important FMG PYQ. We have a patient of diarrhea with no dehydration. We have a patient of diarrhea with some dehydration and severe dehydration. And we all know if the child is eagerly drinking the bottle of water, that is some dehydration, and not at all drinking at all, that's severe dehydration. And the color coding category is green, yellow, pink. That is green, yellow, pink. So this basically comes under yellow color category. This comes under yellow color category. So green, yellow, pink. Sabka yahi hai. That's right. So this is very, very important. Okay. Green, yellow, pink. So this is the yellow color coding. Remember that. A teenage boy who was previously raised as a girl, present with primary amenorrhea, absence of secondary sexual characters. He is very tall, small testes, and gynecomastia. So, tall patient with micro penis and gynecomastia. Tall patient with micro penis and gynecomastia. What are we talking about? Imagine we're talking about Klinefelter syndrome. This again was a question: 28-year-old couple not able to conceive a baby, and the husband was a case of tall stature with micropenis and gynecomastia. Remember, that is Klinefelter syndrome. And what is the karyotype for Turner syndrome? The karyotype for Turner syndrome is 45XO. Link and study. Okay, मरने से पहले link and study. So karyotype very importantly, that is what you called so that is what you called Turner syndrome. Remember that. D कुछ भी नहीं छुएता वो पागल बनाने के लिए. Which genetic syndrome results from deletion of a short arm of chromosome of 5p? So 5p deletion, very importantly, cat-like cry. The patient will have a cat-like cry and microcephaly. So very importantly, yes, we're going to talk about Cry-du-Chat syndrome. So very importantly, Cry-du-Chat syndrome, you should know. Patau syndrome, any idea what is special point? P for Patau syndrome, P for polydactyly. P for Patau syndrome, P for polydactyly. And yes, you're right. Patau syndrome is trisomy 13. Patau syndrome is trisomy 13. Very good. That's yes, nice pharmac question. So we have benralizumab. Benralizumab acts by targeting which of the following immune mediators or a receptor? This is very important question. So very importantly, we all know that ABCD. What's the best answer? Yes, that's right. Option number B. So in a case, okay, benralizumab. Remember, it is basically target on the anti-interleukin 5 receptor. So anti-IgE receptor. Any idea? Anti-IgE is which drug acts on anti-IgE? So we have omalizumab. We have omalizumab basically which acts on anti-IgE. Okay. So this is important pharmac question. Whereas interleukin 4. Any idea? Anti-IL-4 receptor which drug acts on? That is dupilumab. That is dupilumab. Remember that. Yes, very good. That's right. Everyone's answering with Divanshu. Very good. And last but not the least, acting on the interleukin 6 receptor, the drug we have is tocilizumab. Tocilizumab. Zumab. Okay, so tocili. Okay, remember that. Okay, so this is like very important for exam purpose. Yes, ये रटने पड़ेंगे दीप्ति, ये तो करना पड़ेगा भाई, ये चार तो अभी रट लो बाबा. ठीक है, क्योंकि in a case of asthma you have it's a increased responsiveness to a stimuli. Okay, to an allergen, increased responsiveness. So whenever I will have allergy to dust, all my interleukins, I all these receptors will be over activated, and to block them we have these drugs. So basically, dupilumab act on interleukin 4, tocilizumab for interleukin 6, very benralizumab for interleukin 5, and anti-IgE is nothing but omalizumab. Somehow, just do it and look at the screen right now. Tell yourself you will always remember this. A patient came with 3-day history of fever followed by centripetal rash of vesicular rash. So very importantly, पानी वाले दाने जो बाद में crust बन गए हैं. So all this vesicular rash which later has become crusted. So straightforward question. This is of chickenpox. And what is the most common complication of chickenpox? The most common complication of chickenpox is secondary bacterial infection. The most common complication of chickenpox is secondary bacterial infection. Okay. And which is the most common complication of mumps? Who will tell me? The most common complication of mumps is otitis media. The most common complication of mumps is otitis media. Remember that. Okay, very good. Okay, and अच्छा measles का बच्चा कैसे आएगा? How the measles question will come? The rash will start behind the ear. The rash will start behind the ear, then the face, and then the trunk. The rash will start behind the ear, then the face, and then the trunk. So all these in measles also in the end it is on trunk, and in chickenpox also it is on trunk. So this is known as centripetal or centrifugal. This is known as centripetal rash. This is known as centripetal rash. Very important for the exam purpose. Centripetal rash. So measles and chicken pox is like so important, and they have huge questions on this one. Clinical feature in smallpox तो eradicate हो गया ना, smallpox पे question क्यों आएगा? ठीक है. So this is very very important. Okay, congenital biliary atresia should be suspected when jaundice is present beyond how many weeks? What do you think, guys? Congenital, yes, exactly. Okay, one second, I'll show you. So congenital biliary atresia will be suspected if you have jaundice for more than 2 weeks. If jaundice within 1 day, this is very important. If the jaundice is there within 1 day or happening for more than 14 days, this is known as a pathological jaundice. Pathological jaundice. Okay. So yes, exactly. That's very true. And in the normal treatment for jaundice, what was the treatment of choice? In general, basically, we give phototherapy. Not in biliary atresia, but in general, we give phototherapy. And if I ask you a question, the baby and the machine, how much different distance should be there between the baby and the machine? The baby and the machine, the distance is 30 to 45 centimeter. The baby and the machine, the distance is 30 to 45 centimeter. What is the wavelength of phototherapy? The wavelength is 450 to 490 nanometer. 450 to 490 nanometer. And what is the power of the machine? The power of the machine is 30 microwatt. The power of the machine is 30 microwatt. And what does this blue light does? ये करती क्या है नीली बत्ती? It basically converts the bilirubin into lumirubin. It converts the bilirubin into lumirubin. And what is this mechanism known as? This mechanism is known as structural isomerization, FMG PYQ. This is the most important mechanism responsible for phototherapy, known as structural isomerization. So that is very very important for the exam purpose, that you should know. Okay, so this is so important, guys. Remember. Now next thing, a child presents with fever, conjunctival redness, and bluish white spots near the molar. What do you think? What is this bluish white spots near the molar? So यहाँ ऊपर cheeks पे दाने हैं. So this is nothing but Koplik spots. This is nothing but Koplik spots. And where do you see Koplik spots? Koplik spots you see in a case of measles. And very importantly, how the rash will start? Yes, we have done that. The rash will start behind the ear. The rash will start behind the ear, and then the face, and then the trunk. And if I ask you a simple question, which is the most common complication of measles. Yes, we all know that the most common complication of measles is otitis media. Remember, the most common complication of measles is otitis media, and the most common cause of death in measles is pneumonia. The most commonest cause of death in measles is pneumonia. And what is the late complication? What is the late complication of measles? The late complication is subacute sclerosing panencephalitis. So this is like very, very important. Okay, the most common complication of measles is otitis media, and the most common cause of death in measles is pneumonia. मेरा पेंट कोट ले आया मेरा कोट ले आया ऊपर. Okay, so has everyone understood this much? Yes or yes, 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 yes. कुछ तुम सोचो, कुछ हम सोचें, फिर खुशी का मौसम आए. तन्हा तन्हा कौन जिया है, रह के तन्हा दिल घबराए. आ जाओ मिलके रिश्ता ये जोड़े, शर्त बदल के सपनों को मोड़े. इससे पहले कि ये दुनिया हमें आजमाए. हो कुछ तुम सोचो, कुछ हम सोचें, फिर खुशी का मौसम आए. यस, जिंदगी का बस एक अंदाज रखें, जिंदगी का बस एक अंदाज रखें, जो तुम्हें ना समझे उसे नजरअंदाज रखें. जिंदगी का बस एक अंदाज रखें, जो तुम्हें ना समझे उसे नजरअंदाज रखें. ओके, लाइफ इज ब्यूटीफुल. वो कहते हैं कि तुम्हारी अगर वो कहते हैं ना, तुम्हारी अगर गलतियों के हिसाब होते तो सोचो कितने फसाद होते. तुम्हारी अगर गलतियों के हिसाब होते तो सोचो कितने फसाद होते. दिल अगर बेनकाब होते तो सोचो कितने फसाद होते. किसी के दिल में क्या छुपा है ये तो रब ही जानता है. किसी के दिल में क्या छुपा है ये तो रब ही जानता है. अगर हम सच में खराब होते तो सोचो कितने फसाद होते. The next question we have: a 12-year-old boy came with hypertension, smoky urine, periorbital edema 2 weeks after a sore throat. What is your diagnosis? So the baby got a sore throat, and 2 weeks after the sore throat, very importantly, the patient got this problem. And also, the renal biopsy will show subepithelial humps. So, where do you see subepithelial humps? It's a straightforward question of post-streptococcal glomerulonephritis. The patient got a streptococcal infection, and that streptococcus, after 2 weeks, attacked the kidney, causing glomerulonephritis. Remember, you will never see hypertension in a case of minimal change disease. The patient has hypertension. So, you will never see hypertension in minimal change disease. Minimal change disease is nothing but nephrotic syndrome. The most commonest, cause for nephrotic syndrome is minimal change disease, where the patient will have hypoalbuminemia or massive proteinuria. So minimal change disease option is already ruled out because okay, I'll reshare the screen also. The minimal change disease option is already ruled out because the patient is having hypertension, and you don't see hypertension in minimal change disease. Why it is not IgA nephropathy? IgA nephropathy can have hematuria. The IgA nephropathy can have hematuria after 1 to 2 days of URTI. After 1 to 2 days of cough and cold, suddenly the IgA nephropathy will show you very fast. Okay, so after 1 to 2 days of cough and cold, you will have this hematuria and IgA nephropathy. And very importantly, why it is not membranous nephropathy? Membranous nephropathy, remember the electron microscopy. The electron microscopy will show a spike and dome appearance. The electron microscopy will basically show a spike and dome appearance. Remember that, okay? Spike and dome appearance, that you should know. Okay, 1 second. हेलो. हाँ जी, हाँ, क्या हुआ? हेलो. अच्छा, वो कोड दे दिया. अच्छा, बस ठीक है, ठीक है, चले जाओ, बस ठीक है, फिर कल मिलते हैं सुबह. नहीं नहीं, तो एडवांस कोई भी नहीं, मौत आ जाएगी एडवांस नहीं है. मेरी क्लास चल रही है. अभी एडवांस, नो एडवांस, नो एडवांस. Driver is asking advance. What do you think, guys? Should you give yes or yes, yes? What do you think? क्या आप एडवांस देंगे ड्राइवर को 500 रुपए या नहीं देंगे? एडवांस सिगरेट दे दो. सिगरेट नहीं मांग रहा, 500 का पत्ता मांग रहा है वो. यस और यस, यस. अच्छा, यस, यस. अच्छा, तुम्हारे मामे का बेटा है वो जो तो इतनी एंजॉय कर. यस प्लीज सर, गिव हिम सर, प्लीज सर. नो सर, प्लीज नो. वो और मांगेगा फिर. That's why he okay. He keep on asking. That's why. Which of the following condition is associated with vitamin A deficiency? Very simple question. What do you think, guys? Which of the following is nothing but very importantly associated with vitamin A deficiency? So yes, very important that you should know that. Yeah, we all know that vitamin A deficiency. We all know it's considered with the bite or spots. Okay. अब ये तो कोई कुत्ता भी बता देगा. Don't get excited. Oh, I answered bite or wow. No. Thank you so much. That everyone knows. Even security guard also knows. But can you please tell me where do you see Vogue try? Oh, where do you see Vogue try? Vogue try very importantly you see in a case of keratoconus. Number one, in keratoconus you will see Vogue try. Where do you see arts line? Arts line you see in a case of trachoma. In trachoma, you will see arts line. Very good. One answer kya? Arpita. Okay. Arshan, Deepti, Dipanshu. Very good. And where do you see Harnor tetrad dots? So Harnor tetrad dots are seen in vernal keratoconjunctivitis. It is seen in vernal keratoconjunctivitis. Okay. So in vernal keratoconjunctivitis, you will see the what we call Harnor Tentra drops. So Bitot spots in vitamin A, Voxtri in keratoconus, arts line in trachoma, and Harnor Tentra dots you see in a case of vernal keratoconjunctivitis. Okay, yes, exactly. Next important question we have. What's the answer for this question? If watchman answer my properties yourself. Okay, that's nice. I was just kidding. 5-year-old child came with palpable purpura, arthritis, and abdominal pain. What are the problem we're talking about? We're talking about Hinong Schonlin purpura, which is because of deposition of like abnormal accumulation of IgA. So IgA accumulation in my skin, the patient will have palpable purpura specifically in my lower limbs. IgA deposition in my joints, the patient will have arthritis, and IgA deposition in my GIT, the patient will have abdominal pain. Even IgA deposition in my kidneys, the patient will have hematuria. Now, this small vessel vasculitis, Hinong-Schonlin purpura, it is a what you called it is a small vessel vasculitis. It is a self-resolving problem. But if the patient is having GIT symptom, then you start steroid. This is an exam question. No, you will not start steroid in palpable purpura if the patient has GIT symptom. हमने करा हुआ है. If the patient has a severe abdominal pain, if the patient has a severe abdominal pain, in that case, basically, you start the prednisolone. Otherwise, it is a self-resolving problem. This was a neat PYQ can come in FMG exam. Which among the following is not included in severe acute malnutrition? So SAM is defined as weight for height less than minus 3 standard deviation, mid upper arm circumference less than 11.5 centimeter, and pedal edema. So please remember height for age. Height for age is not included in the SAM definition. 2-year-old child, bowing of legs. What do you think? Yay! 2-year-old child, bowing of legs. Can it be rickets? Can it be scurvy? Can it be rickets? Can it be scurvy? So scurvy is a painful condition. Okay, scurvy is a painful condition. Very importantly, that is why the best answer is rickets. And what is the X-ray finding of rickets? What do you think? For the X-ray, very importantly, you will have a cupping, fraying, and splaying appearance. You will have a cupping, fraying, and splaying appearance. Last 5 minutes, the class will get over at 8:30 p.m. sharp. So you have last 8 minutes left. Last 8 minutes, then this class is done for today. The questions are done. So rickets, the X-ray finding is cupping, fraying, and splaying appearance. Where in treatment, you give vitamin D. We give 60,000 international units. You give vitamin D, 60,000 IU. Whereas scurvy, it is a painful condition, very importantly, where you have this tremor field zone, the thin pencil-like cortex, So this is very important. Okay, class. No, thank you. Very sweet of you. 12-year-old girl evaluated for pubertal development on examination. She has a early breast development with sparse hair. So early breast development with sparse hair, so, or thin pubic hair, basically, that is stage two, because stage one is pre-pubertal. Stage one is pre-pubertal. Stage two, you will have little bit of a thin hair. What happens in which stage of SMR do you see generalized breast development? In which stage of the SMR do you see generalized breast development? Seen in stage three. And in which stage you will see ये इतना मोटा breast बना दिया मैंने. In which stage, very importantly, you will see nipple and areola separately seen. That happens in stage 4. Generalized breast development you see in stage 3, and nipple and areola separately seen you see in stage 4. Which is the first visible sign of puberty in a girl? Which is the first visible sign of puberty in a girl? The first visible sign of puberty in a girl is the parents meeting. P for thelarche, that is a breast development. P for pubarche, and M for menarche. Okay, so the first visible sign is breast development. The last visible sign is menarche, and the parents' general meeting, the patient's general meeting. So, growth spurt. After pubarche, remember you have a growth spurt and then you have the menarche. Thelarche, pubarche, growth spurt, and menarche is the ascending order of the changes of puberty in females. The image shown below depicts characteristic skin lesions. Which nutrition problem? So perioral, perivaginal, perianal area rashes. It because of it nothing but the condition is known as acrodermatitis enteropathica. Acro means periphery and dermatitis means rash. Acro means periphery and dermatitis means rash, and plus the patient will have diarrhea. So this is acrodermatitis enteropathica, which is deficiency of zinc. And what is the gene mutation? SLC39A4 star mark FMG PYQ. So SLC39A4 gene mutation you see in a case of zinc deficiency. And ATP7B gene mutation, can we revise the other gene mutation? ATP7B gene mutation you see in a case of Wilson disease, whereas ATP7A gene mutation you see in a case of Menke disease. We can clear. Life is beautiful. It's easy. कोई कुत्ता भी कर लेगा. We'll do it. We will do it. You will shine like this beautiful bird. Are you the beauty? Is the beauty in you? Do you think you deserve this? Yes, 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 because you were born beautifully amazing. But remember, very, very importantly, do what is right, not what is easy. Do what is right, not what is easy. What is right? Watching movies on Netflix, criticizing the whole planet. And if no one is available, God is there. God has ruined my life and all that. But that is very right. But what is easy? So very importantly, now do what is right and do what is easy. I spoke the opposite. The easy is to criticize, and the right thing is that you are responsible the way you are. You are responsible for the way you are. You are the most beautiful thing ever happened on mankind. Next question. Which vaccine is typically kept in the lowest compartment of ILR? What do you think? What is ILR? Ice-lined refrigerator. It is a ice-lined refrigerator. So the lowest thing we keep over it, it's the coldest one, no? So we keep the OPV over there, okay? Above that, what will you keep? You will keep the BCG and MMR in the ILR I'm talking about. Then all the TT, hepatitis A, hepatitis B, TT, DPT, all these things you will keep. And what is the top compartment of the ILR you will keep? Will you keep Budweiser Magnum? No, the answer is soda bottle. No, 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 no. The answer is diluent. So the top compartment you will keep the diluent. In the lowest compartment you're keeping the OPV. This is not a domestic refrigerator. It is the ILR. And what is the diluent of BCG? Any idea? What is the diluent of BCG? The diluent of BCG is normal saline, and the diluent of MMR. Any idea what's the diluent for MMR? The diluent for MMR is distilled water. The diluent of MMR is distilled water. Very regular. Very, very regular community medicine question. Remember that. 3-year-old child came with recurrent chest infection, steatorrhea, and failure to thrive. Steatorrhea is fat globules, fatty stool. On examination, the child has clubbing and bilateral crepitation. Sweat chloride test is positive. So it's simple, straightforward. Sweat chloride test is positive. The answer is cystic fibrosis. And what is the cutoff for sweat chloride levels? More than 60 milliequivalents per liter. Let me ask you one extra question. In cystic fibrosis, this is a salty tasting skin, cystic fibrosis. Okay. So all the secretions get stuck. All the secretions get stuck. So that is why the patient will have pneumonia. Now, I have a question for you guys. Which is the most commonest cause of pneumonia in cystic fibrosis? So very importantly, it is Staphylococcus aureus. Yes, you are right. It is a Staphylococcus aureus followed by Pseudomonas aeruginosa. Staphylococcus aureus followed by Pseudomonas aeruginosa. This is important for the exam purpose. Remember, okay, this is a very important point. The most commonest cause for pneumonia in cystic fibrosis, MCQ, is Staphylococcus aureus followed by Pseudomonas aeruginosa. And which is the most commonest cause of mortality? Any idea? The most commonest cause of mortality the patient will have is because of Burkholderia cepacia. MCQ is the most commonest organism responsible for mortality of cystic fibrosis. Very importantly, is nothing but Burkholderia cepacia. Burkholderia cepacia. Okay, so this is important for the exam purpose that you should know. Calculate Downey score of a newborn baby. Okay, we all know for the distress assessment of a baby, we have Silverman and Anderson score, and we have the Downey score. But I have not learned Silverman, Anderson, or Downey's. How should I answer? It's very easy, dear. Zero, 1, and 2. If it is a happy baby, zero score. If it is a very bad or a sick baby, it is the two score. If the baby is having mild to moderate problem, if the baby is having mild to moderate problem, the baby is one score. This much background you should know. The baby who has cyanosis, which improves on giving oxygen. So number one, no cyanosis, zero score. A cyanosis which improves on giving oxygen, how much number should I give? One number. If no improvement at all, no improvement at all, how much number I should give? Two number. Mild to moderate retraction, what do you think? How much number? One number. Because no retraction, zero number, and mild to moderate retraction, one number, and marked retraction, two number. Grunting heard on naked ear, how much number? So obviously no grunting, I would have given zero number. Grunting heard on stethoscope, if I put my steth, grunting is heard, one number. And naked ear, ऐसे ही सुनाई दे रहा है, like this only I can make out the baby is having some abnormal sound, that is a two number. And air entry marked decrease, whenever the word come marked, the answer is two. RR 40, the normal RR of a newborn is 40 to 60, so it's normal. So दो दो चार पांच और छह. What is the best answer for this question? The best answer for this question is six. Okay, remember. So same story goes for Silverman Anderson score and Downey score. This is the PYQ. So they will ask you calculate the Apgar score, calculate the Silverman Anderson score. Most common organism for croup. What do you think? Croup is caused by very importantly so para-influenza virus, influenza or para-influenza, both are there. That's it. That's okay. Last question. Okay. Yes. Yeah. Ah, okay. So that's perfect. So we have the last question for this class. Last question for this class is this. Which of the following is not a sign of some dehydration? Very importantly, in a 5-year-old child. Last question. What do you think, guys? Which of the following is not a sign of some dehydration? So some dehydration, delayed pinch, sunken eyeballs can happen, but lethargy, it is a sign of severe dehydration. Lethargy, it is a sign of severe dehydration. We all know that lethargy, it is a sign of severe dehydration, right? That's right. And one more question for you guys. What is a drug of choice? What is a drug of choice for chemoprophylaxis against Neisseria meningitidis? If the patient is having Neisseria meningitidis, then which is the drug prophylactic the whole family should take? Prophylactic the whole family should take is rifampicin. This is the pharmacology. If some family suffering from Neisseria, other family members as a chemoprophylaxis should take rifampicin. And if the patient is having pertussis, let me ask you one extra question. If the patient is having pertussis, then which drug the whole family should take? The whole family should take azithromycin. Whole family should take azithromycin. If the TB is having, then the whole family should take which drug? Prophylactic in general, the child should take which drug? Isoniazid, INH. If the someone is TB positive, then you know what you called. Yeah, this is the last question. Don't worry. Let me reshare Let me reshare the screen again. Okay, so that's what. So yeah, I have reshared the screen. If one is having Neisseria, the other family member should have rifampicin. Someone having pertussis, the other family should member should have azithromycin. And if someone is having, very importantly, acha, is my voice coming to everyone? Yes or yes, yes. Okay, okay. 1 second. Some internet issue coming. Okay. Yeah. So very importantly, is my voice coming to everyone? Yes or yes, 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 yes. This is the last question, so we'll stop here only. If the patient is, if the mother is TB positive, the baby should take which drug? The answer is isoniazid. And last but not the least, if someone is having influenza, if someone is having influenza as a chemoprophylaxis, the other person should take what drug? The answer is oseltamivir. Okay, as well mavir they should take. Okay, so this is very very important that you should know. So this is a very important class. For influenza as a chemo prophylaxis, I should take oseltamivir. Someone having TB, I should take isoniazid. Someone having pertussis, I should take azithromycin. Someone having Neisseria, I should take rifampicin. So a little bit of that's lag is happening. So that's it. Let's finish the class here only again. Thank you so much, everyone. Thank you so much, everyone. That finishes this class because a lot of little lag is happening. So I think we'll wind up here only. Thank you so much. Best of luck. Best of luck for your FMG exam. I know you will rock it. I know you will just crack it like crazy. And that's it. So lots of love. हम होंगे कामयाब. We are born beautiful. We are born amazing. Lots of love from my side. Please take care. See you very soon after getting the best marks, and you will get it. Okay. Deep breathing, and you have got this. Remember, okay. So please take care and thank you.
Hello friends, welcome back. So okay dear. Now we start with the topic left. We left at zinc. You know, acrodermatitis enteropathica. Acral dermatitis at acral is an periorificial tip of finger. Okay. It is autosomal recessive disorder in which enteropathica means gut is affected, intestine is affected. So zinc deficiency is there, zinc absorption is affected. Okay. So diarrhea and dermatitis simultaneously, inflammation around nose, mouth, anus, cheek, and elbow. So typical, many times you will find image-based question and you will find this typical picture. Yes, this is zinc deficiency. Diarrhea, dermatitis, zinc deficiency. Sometimes they will try to give other symptoms and will try to confuse you. Yes, 1 minute, hold on. Okay. Yes. सेम लिंक है या डिफरेंट है? मैं एक बार चेक कर लेता हूँ. Okay. So now, diarrhea, dermatitis, sometimes they will try to confuse, give different symptoms. So you will keep in mind that dementia, diarrhea, dementia, dermatitis, 3D, 1 point. And if they give dermatitis, typical dermatitis of pellagra is sun-exposed area, castle neck appearance. Castle neck appearance. Okay. Zinc deficiency, multiple time question has been asked. Mnemonic is hide. H for hypogonadism, H for healing, delayed wound healing. Zinc deficiency lead to hypogonadism. Direct question, single liner has been asked. Clinical scenario in which delayed wound healing, decrease immunity, diarrhea, D for diarrhea, DE for dermatitis, plus alopecia. This has been given in clinical form. Yes. Yes. Okay. Now, Menkes disease and Wilson disease. In Menkes, M downward, so copper is decreased, copper deficiency. Wilson upward, so copper excess. You all know, it's very simple. But many times they ask question and you are confused between 7A and 7B. ATP 7A protein defective in Menkes disease, 7B defective in Wilson disease. One mnemonic, simple mnemonic, you can remember M comes first, W comes later. So A for Menkes and B for Wilson. Or simply, if 7B you find B for beta, sun, Wilson. Sun matlab beta. Okay. In Minky Kinky hair's disease, we found that gray depigmented hair. Why? Normally, tyrosine is converted to melanin. Melanin is black pigment, and enzyme is tyrosinase. Tyrosinase is classified as oxidase, and the cofactor is copper. Cofactor is copper. So copper deficiency, tyrosinase will not work, melanin will not be synthesized. That's why gray depigmented hair. We found that lysyl oxidase, that was lysyl hydroxylase. Point it out. This is lysyl hydroxylase. Prolyl hydroxylase. These require vitamin C. Okay. So lysyl hydroxylase require vitamin C, but lysyl oxidase require copper. Okay. And so if copper is deficient, lysyl oxidase will be affected. So defective and weak collagen synthesis. Lysyl oxidase is also required for collagen maturation. So copper deficiency lead to brittle kinky hairs. So these are questions, common questions. Now, heme synthesis, recently asked question. In heme synthesis, first step is succinyl coenzyme bind with glycine to form delta aminolevulinic acid by aminolevulinic acid synthase. This is the rate limiting enzyme, and cofactor is vitamin B6. Cofactor is vitamin B6. We found that a question was asked, which intermediate of Krebs cycle take part in heme synthesis? Which intermediate of Krebs cycle? Succinyl coenzyme is intermediate of Krebs cycle, take part in heme synthesis. Two molecules of aminolevulinic acid join to form porphobilinogen. And the name of enzyme is L-dehydratase. Point it out that this enzyme lead to formation of porphobilinogen. That's why another name of L-dehydratase is porphobilinogen synthase. Porphobilinogen synthase. Question has been asked. We found that lead poisoning, mnemonic LEAD, cap D for dehydratase. So when question is asked, lead poisoning inhibit. Option A, synthase. Option B, dehydratase. And we usually get between synthase and dehydratase. So simple mnemonic is LEAD, D for dehydratase. L-dehydratase is inhibited. and another name is porphobilinogen synthase, which is inhibited. Okay. Lead poisoning. In lead poisoning, you will find history of worker in paint or child eating paint from wall. Sometimes you will find that patient is having pain abdomen, tingling sensation. Okay. So pain abdomen, lead poisoning symptoms, tingling sensation. These symptoms in clinical scenario commonly asked. Okay. So lead poisoning inhibit this aldehydatase, another name porphobilinogen synthase, also inhibit ferrochelatase. One more enzyme is also inhibited, that is coproporphyrinogen oxidase. Okay. Now, so till now we have synthesized porphobilinogen. Why this topic becomes important? Because they have recently asked in January this step. Okay. So this topic is being asked. So we should remember the important one. Okay. This porphobilinogen, four molecules join to form hydroxymethylbilane by porphobilinogen deaminase. Porphobilinogen deaminase. This point is important because three name for the same enzyme and frequently asked question. Porphobilinogen deaminase, ammonia is removed, so deaminase. In this hydroxymethylbilane is synthesized. So that's why the other name for the same enzyme is HMB, hydroxymethylbilane synthase. Okay. We found that this hydroxymethylbilane is spontaneously converted to, yes, spontaneous uroporphyrinogen 1. That's why you can say that this reaction is a continuum. So ultimately, with the help of this enzyme, this part is spontaneous. With the help of this enzyme, uroporphyrinogen 1 is synthesized. So we can say that other name is uroporphyrinogen 1 synthase. So three name for the same enzyme. Okay. Got the point? Why I'm focusing on this? Because most of time you will find question on this acute intermittent porphyria. In acute intermittent porphyria, uroporphyrinogen 1 synthase is deficient. Mnemonic, simple mnemonic, frequently asked question. They ask question on this name usually. But they can ask on HMB synthase, porphobilinogen deaminase, three name for the same enzyme. Deficiency lead to acute intermittent porphyria. I looks like 1. I looks like 1. Acute itself tells you there would be acute abdominal pain. Acute abdominal pain. When pain would be so severe, patient will go to emergency, will be operated. Yes. Multiple scar mark. No cutaneous photosensitivity. In this, neuropsychiatric symptoms are there. So this is important, acute intermittent porphyria. We found that hydroxymethylbilane is converted to uroporphyrinogen third by uroporphyrinogen third synthase, 3 synthase. If this enzyme is deficient, then it lead to congenital erythropoietic porphyrias. Congenital erythropoietic porphyria. Okay. This question was asked, uroporphyrinogen third is going to coproporphyrinogen third by uroporphyrinogen decarboxylase. Out of these enzyme, only one decarboxylase is deficient, and this decarboxylase is deficient in porphyria cutanea tarda. How you remember? Kata toda. Kya kata, kya toda? Yes, carbon dioxide. So kata toda, carbon dioxide, decarboxylase, porphyria cutanea tarda. Yes, they have asked this question. Patient present with photosensitivity, purpura and blister skin, lesion on sun exposed area. Biochemical show defect in conversion of uroporphyrinogen third to coproporphyrinogen third. Uro to copro. So which enzyme is deficient? Yes, the answer is decarboxylase, uroporphyrinogen decarboxylase. Okay, answer is B. Okay, dear. Now, 2 oxidase enzyme deficient. Coproporphyrin oxidase deficient in heterocoproporphyria, protoporphyrin oxidase varicate porphyria, ferrochelatase deficient in erythropoietic protoporphyria, and in all these, cutaneous photosensitivity is present. Okay. Heme catabolism, question was asked. Heme is converted to biliverdin, O2 join, NADPH, production of carbon monoxide. This is the pathway in which endogenous carbon monoxide is produced. Iron is produced. Okay. So this question was asked, which is not a product of heme catabolism. Even if you don't know heme catabolism, you can answer. The answer is B, because you know that amino-levulinic acid is synthesized in heme synthesis, not catabolism. But we know now the catabolism: biliverdin, yes, CO2 and iron. Biliverdin, CO2, sorry, carbon monoxide, not CO2, sorry. Carbon monoxide, not CO2, carbon monoxide and iron. Okay, endogenous carbon monoxide. Yes, answer is B. Now, last topic, that is enzyme involved in alcohol metabolism. Enzyme involved in alcohol metabolism. You all know alcohol is converted to aldehyde by alcohol dehydrogenase. Dehydrogenase means removal of hydrogen. Hydrogen is taken up by NAD to form NADH. If I take ethanol, the alcohol we take should not be taken, but जो लेते हैं अवॉइड करना है, हमने एथेनॉल नहीं लेना है, अच्छी चीज नहीं है. ओके, एथेनॉल is converted to acetaldehyde, then acetic acid, then acetic acid. Okay, so this ethanol is we use, and whenever we use ethanol, this produce NADH, and one NADH produce 2.5 ATP. That's why you get empty calorie. Means after taking alcohol, you will get sufficient amount of energy. You will not feel hungry. When you will not feel hungry, you will not take proper diet, and there would be multiple vitamin deficiency. One of them is vitamin B1. Most common deficiency on which question is asked, vitamin B1 deficiency. Okay, so alcohol से energy आती है. You all know, you have seen so many memes in which a person after taking देसी ठर्रा बुल को पकड़ता है, yes, and ट्रक को रोक देता है. So means give energy, but we should take proper food with that. Why? Otherwise that will lead to multiple vitamin deficiency. This methanol, yes, is converted to formaldehyde, formic acid. Formic acid causes optic nerve damage. This is the reason that methanol is poisonous. Whose tragedy or spurious alcohol tragedy means methanol poisoning? Yes. What happens in methanol poisoning? Formic acid is increased. Definitely it is increased. Second point. Yes. When NADH is increased, NADH bind with pyruvate and convert into lactate. Convert into lactate. Okay, lactate means lactic acidosis. So this question was asked that methanol poisoning, there would be increased formic acid, increased lactic acid. This was the question. Now, this is the reason that whenever you find that any ethanol, which is given by government on subsidy, they mix little bit amount of methanol. तो तुम उसे रिक्रिएशन पर्पस के लिए यूज नहीं कर सकते, तो जानबूझ के थोड़ा सा मेथनॉल मिला देते हैं. ओके, सो वन thing is that pyruvate is converted to lactate. Now, how question was asked? Suppose you cleared FMGE, now you entered JR1, okay, internship or JR1. That is quite hectic schedule. You took breakfast, now OPD ward, you skipped lunch. Now, MR throw party, you attended party, you did not take food, okay, you took alcohol, okay. In night, you are in emergency with hypoglycemia. Why? Why hypoglycemia? Because we found that liver will try. You took breakfast. After that, liver said, you thought that my liver will maintain blood glucose. No need to worry. Liver will try to maintain blood glucose by gluconeogenesis. But in gluconeogenesis, the first step is pyruvate to oxalate by pyruvate carboxylase. But after taking alcohol, you converted pyruvate to lactate. So pyruvate is not there. When pyruvate is not there, liver will not be able to do gluconeogenesis. So ultimately, yes, hypoglycemia would be there. Suppose this hypoglycemia patient, your friend, came to emergency. What treatment you will give? In treatment, first you will give IV thiamine, then you will give dextrose, IV dextrose. So पहले thiamine देंगे, बाद में dextrose देंगे. Why? Two reasons. One, if you give dextrose without thiamine, we know that dextrose means glucose. Okay. This glucose or dextrose will be metabolized to two molecules of pyruvate. This pyruvate will be converted to acetyl coenzyme A by pyruvate dehydrogenase, Cofactor is thiamine vitamin B1. But this patient, thiamine is already deficient because chronic alcoholic patient, or due to alcohol, thiamine deficiency is already there. And now you give glucose, so the remaining thiamine will be utilized in this reaction. There would be acute deficiency of thiamine that may precipitate wernicke's encephalopathy. ठीक है, तो wernicke's encephalopathy गोवा में चले जाओगे तुम, ग्लोबल कंफ्यूजन, ऑप्थेल्मोप्लेजिया एंड अटेक्सिया. दूसरा रीजन, B1 is deficient, so whatever extra pyruvate would be there, that will not be converted to acetyl coenzyme A and will be diverted towards lactate formation. So increase lactic acidosis. So first give thiamine, then give dextrose. This is the question. Okay, dear. Now, this question was asked in FMGE July 24 to check blood alcohol concentration. We do potassium dichromate test. In this, potassium dichromate is converted to chromium with the help of ethanol. Yes, depending on the concentration of ethanol present in the patient, yes, blood alcohol concentration, yes, this potassium dichromate will be converted to chromium, green color. This dichromate is orange color. If concentration is more and more green color, so intensity of color change is used to estimate blood alcohol concentration. Yes. So we have covered most of the topic for our exam. The only thing now you require confidence in your hard work. Yes. Confidence in your memory. Yes, many times we start feeling that I have forgotten so many things, but trust me, you do remember. Delirium tremens, एक क्वेश्चन आया है. You will remember in alcohol related disorder, कोई भी alcohol related disorder हो, the thiamine is treatment. Wernicke's encephalopathy, IV thiamine. Course of psychosis, oral thiamine. Delirium tremens, IV thiamine. Okay. So, yes. इसमें बच्चे हीम सिंथेसिस में इंपोर्टेंट याद रख लेना है तुमने. रेट लिमिटिंग एंजाइम, dehydratase inhibited by lead poisoning. This recently asked question. Porphyria cutaneous tarda. Okay. This acute intermittent porphyria. Okay. So thank you for patience listening and coming back again. Yes. So we will meet again shortly after exam. Yes, if you have any doubt, you can ask me. 51397004. So best of luck. Thank you. लव यू ऑल, टेक केयर बच्चों।